Hello all, myself Helena Joy, lecturer from SNS College of Allied Health Science, Department of Radiography and Imaging Technology. I am going to discuss a topic about CT artifacts. Artifacts are one which not only degrade image quality but also leads to wrong or misdiagnosis. The typical artifacts in CT images are motion artifact, streak artifact, beam hardening artifact, ring artifact, partial volume artifact, spiral artifact and rod artifacts. Motion artifact. The patient motion is random or unpredictable during CT scanning. Example, patient sneeze. The image will display the object motion as a streak in the direction of the motion. It depends on the density of the object in motion, and density is much different from the surroundings produces more intense motion artifact. Motion artifacts are more prevalent in scan times of 0.5 to 2 seconds due to involuntary and voluntary patient motion. CT brain showing motion artifact. Structure moves from one voxel to another and introduce errors in reconstruction. Motion artifacts appears as double image or image ghosting that may lead to rescanning. Streak artifacts. Streak artifacts are due to absence of transmitted X-rays to the detector and it appears as dark and light lines. The source of streak artifacts are high density material such as metal implants, dental amalgam and shotgun pellet, etc. Streak artifacts increase with motion and metal correction algorithms are provided in some CT scanners. Streak artifacts are due to absence of transmitted X-rays to the detector and it appears as dark and light lines. The sources of streak artifacts are high density material such as metal implants, dental amalgam, etc. Streak artifacts increase with motion and metal correction algorithms are provided in some CT scanners. CT abdomen showing streak artifact. Beam hardening artifact. Beam hardening artifacts are or cupping artifacts are caused by polychromatic nature of X-ray beam. As the beam passes through the patient, low energy is observed and the mean energy decreases. As a result, the beam becomes hardened that causes underestimation of Hounsfield unit. It is possible to minimize the beam hardening effect by suitable correction algorithm. Beam hardening artifacts are marked at high contrast interfaces. Example, petrous bone in the head. Brain showing beam hardening artifact. Ring artifacts. Ring artifacts is the result of miscalibration or failure of one detector in rotate system of third generation CT scanner. Due to the failure of the particular detector, incorrect data in every projection will appear as a ring in the image. Radius of the ring is determined by the position of the detectors in the array and virtually disappeared in the contemporary CT units. CT brain showing ring artifact. Partial volume artifact. Partial volume artifact is result of averaging the linear attenuation coefficient in a given voxel that is heterogeneous in composition. Example, presence of bone and soft tissue. This artifact increases with increasing pixel size and slice thickness. It is pronounced for softly rounded structures that are parallel to the CT slice. For example, when cranium shares few number of voxel with brain tissue, there is loss of details of brain parenchyma. Use of thinner slices and helical scan with interleaved reconstructions will reduce partial volume artifacts. Example, 5 mm slices at the interval of every 2.5 mm. Spiral artifact. A helical scan gives an image similar to partial volume averaging. In one direction, The partial volume averaging is determined by collimation, and in other direction it is by collimation and table increment per rotation. As a result, instead of perfect cycle, an eclipse-like reconstruction is done. It is more apparent for large pin top angle and large pitch. Example, spiral scans of the top of the brain. It is seen as two crescent-shaped bands of increased density along the skull-brain interface, which mimics a subdural hematoma. These bands rotate around the brain as the X-ray tube rotates around the patient. Rod artifacts. Rod artifacts are apparent when high contrast objects vary in shape or position. For example, if a cylindrical object angulated with respect to the scan plane, then every projection locates the cylinder at a different position. As a result, the cylinder would appear as ellipse without the table motion. With the table motion, the ellipse gets distorted, extending to surrounding tissues and commonly seen in the liver or rib area. Thank you.